Hi, I'm Dr. Nishant Yagnick. I'm head of neurospine surgery in Fortis Hospital in Manesar. Today, I want to tell you about revision spine surgery. So, we are a center of excellence for spine. We have a high volume center for spine and we get patients from across the world. And many of these patients have already had treatments and operations before, but don't have the necessary relief. The reason for this is often because the disease and the problem has been misunderstood before, and while standard therapies have been applied to them, the exact focus, which is the neurological focus for their pain or their weakness or their numbness, has not been addressed. Revision spine surgery from our side entails two things most importantly. The first is to clinically identify which nerve in the spine is pressed, because many times the main nerve that requires targeting has not been targeted before by the previous clinicians. So when we identify this, we can directly focus on it through a microscopic approach with rarely any requirement of increasing the scar or increasing the mobility. When we target this, we make sure that we see the complete nerve and its decompression and make sure that that nerve is now free of any compression, even if it is multiple nerves along the spine. We also do revision surgeries in terms of the stability of the spine. I have patients who have come from various countries with just decompressions and now the spine has become unstable. That requires a very specific kind of fixation of specific levels. That gives titanium strength to the spine and lifelong strength that builds the stability. A third most important surgery that we do is called spinal cord stimulator surgery. So we get a lot of patients with spinal cord injury and paralysis, and we get patients of complex regional pain syndrome, which means that their pain just does not go away. So we place special kinds of instruments which gives stimulation to the spinal nerves and therefore reduce the pain gate pathways. This is highly effective and life-changing for complex regional pain syndrome patients. So with all of these approaches, we are able to give most of our patients a much better quality of life and relief after our surgery. Thank you.